From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is flu season is just around the corner. What are you doing to stop the spread and to protect yourself? According to the CDC, every year in the U.S. alone, there are approximately 36,000 deaths and 220,000 hospitalizations related to seasonal influenza. But what about the thousands of lost work days due to workers staying home because of the flu or to care for a family member with the flu? Some estimates are as high as 21 million work hours lost annually. And while flu seasons are unpredictable in many ways, like timing, severity, length of season, we do know it is coming, and there are things we can do to protect ourselves and those around us. The first step to prevention is to get your seasonal flu shot. Since flu strains change from year to year, it is important to get a flu shot every year. Last year, we saw the emergence of the H1N1 virus, and while not certain, it is likely that H1N1 will continue to spread along with seasonal viruses during this year's flu season. Most local systems have flu clinics, and you should check your local system for dates and times. Most have posters in common areas to alert employees of when these clinics will take place. You can also find dates and times in your local newsletters. Some of our local systems are holding drive-through flu clinics again this year to help their community fight the spread of flu. Hampton Roads has held drive-through flu clinics for several years in a row, and they have had a great deal of success with the concept. According to Dr. Carl Wenzel, director of Bon Secours Emergency Department at Harborview, the concept is to make getting the flu shot as easy as possible. And here's how it works. It takes about 20 minutes to complete the entire process. First, there is the paperwork, which checks for any medical conditions or medications you might be taking, among other things. Then you get the shot, sitting in your car, if you so desire. And finally, there is a 10-minute wait to make sure there are no reactions. According to Dr. Wenzel, it's not quite as fast as going through McDonald's, but it's pretty quick. Influenza season is here, and there is time to protect yourself and others so that as clinicians we can continue to be good help to those in need. In other news, flexible spending accounts can be a great way to help reduce your health care and dependent care costs. But there are some things you should know about the FSA, and we've got the facts, starting with when can you enroll? This year, FSA open enrollment is Monday, November 1st, 2010 through Friday, November 12th, 2010. After November 12, 2010 through midnight December 31st, 2010, you can still enroll, but you have to contact Bon Secours Customer Support Center at 877-788-4693. Next, how much can you contribute? Employees can contribute up to $5,000 to the Health Care FSA and up to $5,000 to the Dependent Care FSA each calendar year. What kinds of expenses are eligible for reimbursement from the Dependent Care FSA? Dependent Care account funds cover the cost of caring for an employee's eligible dependents while the employee is at work. Examples include before and after school care charges other than tuition, summer day camp fees, licensed daycare center charges, nursery school and preschool fees, and custodial care expenses for adult dependents. What kinds of expenses are eligible for reimbursement from the Health Care FSA? Health care account funds can be used to pay for out-of-pocket health care expenses that are not reimbursed by a health plan. Examples include office visits and prescription drug copays, deductible amounts, co-insurance amounts, and over-the-counter medications and drugs. Well, those are the basics, and we encourage everyone to find out as much as you can about this valuable benefit available to Bon Secours employees. You should already be seeing posters and table tents around your facility, but also look for healthcare reimbursement letters and FSA postcards in the mail. Flexible spending accounts are just one of the valuable benefits offered by Bon Secours, but you have to elect to participate. Finally, this week is National CAP Appreciation Week. What is CAP Appreciation Week? Well, many companies have an accounts payable department, and most are misunderstood. CAP Appreciation Week is designed to help inform everyone just what this often misunderstood function is all about. Here at Bon Secours, we do appreciate our colleagues in accounts payable and caught up with the Director of Central Accounts Payable, Joel Stafford, for a conversation about CAP Appreciation Week. Let's listen in.
My name is Joel Stafford. I'm the Director of Central Accounts Payable and Facilities.
Something's happening soon that affects Central Accounts Payable. What is that?
Yes, it is AP Week. It's a nationally recognized week for accounts payable professionals. It's the third week of October, and we are really looking forward to it. It's something we celebrate each year with our CAP department.
Well, how do you celebrate CAP Week?
Each day we'll take an hour out of the day and do something fun or something reflective. We'll bring some of the senior executives in to say a word or two to the group. And we just use that week just to really celebrate and thank them for what they do. Many times accounts payable is a thankless job. Where's the check? You know, no one recognizes when the invoice gets paid 99% of the time. And so it's just good to reflect and thank them, thank the staff for what they deal with every day. Yeah, over the past year, I'll give you an example of one thing that we instituted is e-payables. We are now paying our bills electronically, at least 1/3 of them. Just in the last 10 months we started this program. Some of those bills are being paid through ACH, like you get your payroll. Others are paid through a credit card solution. It's a credit card automation system, and we are earning a rebate on every dollar that we pay. And that rebate is going to amount to over $1.1 million this year. And that's a new program that we didn't have last year. So that's 1.1 to the bottom line of BSN. Basically due to the hard work that folks are doing in CAP.
Well, it sounds like you got something to celebrate.
Absolutely, absolutely. It's been a great year for us. We really have. We put in a couple automation projects. We put in this e-payables. We've started a P-card audit program that will audit all of our P-card transactions. So we feel as though we're doing things more efficiently as well as adding value to BSN.
This week, if you get a chance, let the folks at Central Accounts Payable know that you appreciate the hard work they do. Remember, you can get more flies with honey than you can with vinegar. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.